My name is Amy Lysyczyn. I am a mother of three. I've been a member of Rutherford County, resident here for 21 years. I am a realtor and I'm a breast cancer survivor. So mine's a little bit unique. I was high risk. My aunt died from complications due to breast cancer about 25 years ago. And then when I was 30, my best friend Erin died from breast cancer. So it made me very hypervigilant, and ironically, about 5 months after she died, I found my first mass and lump, and we did a surgical biopsy, and then that started regular mammograms. So I've been having regular mammograms for a long time. I'm 45 now, and basically about 4 years ago now, they found a mass that they were monitoring, and it kept changing and growing. So we went in every 3 months, and my doctor, Dr. Carter, who is retired now but was with MMC, he monitored it very, very closely. And on a whim, we said, how come we've never done genetic testing? And so we did it, and within 2 weeks, I got a call that I was BRCA1 positive, which is the worst, pretty much, genetic mutation that you can have. So immediately I was scheduled for my ovarian surgery removal, and then I had a double mastectomy in October of 2019. And so at that point, it was prophylactic. Ironically, the breast cancer wasn't in my left side, it was in my right side. So it saved my life. I was fortunate they were able to get clean margins, but I did not, so I didn't have to do chemo or radiation. However, they did immediate reconstruction. My surgeon was Dr. Medling. He's fantastic. He's a miracle worker. And I had infections 3 times. So I lost my left side 3 times. And then eventually we had to just surrender, and I had to wave the white flag because I got too many infections and it just wasn't working. So I had to lose them permanently. I went through all of this during the pandemic, like the heart of the pandemic. I'm also a severe asthmatic, so my family was completely isolated. I have 2 little girls at home, and they didn't leave the house for a year. In addition, my husband at the time, his employer died from COVID right out of the gate. I was in the hospital during COVID, getting surgeries and infections and all that stuff. So there was a real disconnect for me. I think some of that was because of the pandemic and just the times that we were in. So yes, things have changed drastically from my experience just because people are out and about in the world again. But something that I've learned is that I really wanted to advocate for other women. I think there is a disconnect between the surgeons, because their passion in their life is to keep you alive. And that's all they're thinking about. So then you get sent out into the world, and sometimes you don't know what your resources are. So I have seen a lot more. Again, it may be because the pandemic has passed, but there are people like this awesome company that maybe I wouldn't have found out about. I know one of the managers here, and that's kind of how I knew about it. But so in that way, I think there could be some approval in our area for that. But I do see it getting stronger through different organizations and foundations, through Ascension St. Thomas Rutherford, as well as MMC, which are the 2 medical providers in this area in Rutherford County. So they're providing resources and telling more patients, I think, and part of it's because I have a big mouth and want to try to help other women. So Pretty in Pink is awesome. Because I went through immediate reconstruction and then had all these complications. I lost my left side 3 times, and simultaneously, while I was going through the infections and the losses on that side, they were still expanding. My plastic surgeon was still expanding my right side. So I felt extremely deformed. And with every surgery, I became more and more deformed. And of course, that hinders your self-esteem tremendously as a woman. So I was really fortunate. Holly Sneed, one of the managers of Pretty in Pink, used to go to church with me, and a nurse had kind of referred me here. And so I came and I met with Holly, and she's also a survivor. And it was the first time I felt like a woman again. The kindness that she showed, it about makes me cry. I have had every size because I was expanding so slowly. One side was getting bigger, and we had to kind of shift as that one got bigger, and I kept losing the other side. And it made me be able to feel normal on days when everything else, being in the pandemic and all those things that the surgeries and infections. I just could feel normal when I wanted to. So that was great. The other thing that was amazing, that was just a game changer, and I think I know I didn't know about that until I came here, is that with the different sizes of breasts, as you're expanding, and if you only have one side that's not, cooperating, like my left side, you're able to get different sizes. And she works, the company works with insurance, so you don't have to stress about any of that. And it's one less pressure that you have on yourself, and you have somebody that's advocating for you to feel whole again. And so it's a really wonderful experience. I can't say enough about the people that work at Pretty in Pink. I think the greatest advice that I'd give to someone that's getting ready to face losing their breasts, or going through treatment, or any of the things that come with breast cancer, is the first thing is not compare yourself with other people. I struggled with that a lot in the beginning, and I compared myself to other stories and people that I met in online support groups and things, and thought something was wrong with me. I had complications that a lot of women don't have, but I also didn't have to have chemo, whereas some people have easy surgeries, easy transition into reconstruction, and no problem there, but they're going through a lot of other hurdles, and whether it be radiation and chemo and the things like that. So I think the biggest thing I would tell people is just to know that your path is your path. It's all hard. It's all so hard. But there are a lot of people like Pretty in Pink, there's other organizations in town that their mission and their drive is to help people that are experiencing these hard times. Definitely don't compare yourself to other people's situation, because everybody's got a unique thing. Lean on people that are there to help you. Know that one size doesn't fit all. And I say that jokingly because at a place like Pretty in Pink, where you're getting prosthetic breasts, it's definitely true. You're not ever going to be the same again, but you can be a new, more awesome version of you if you just let the people that want to help you and love on you do that. And Pretty in Pink is a great place for that. So here's the thing with prosthetic breasts. They're a pain like regular breasts are. Sometimes you want them, sometimes you don't. There are people I know, I have friends that wear their prosthetics all the time, every single day, and people don't even know that they had experienced breast cancer or a mastectomy or double mastectomy or whatever it may be. I have found that I have days that I am so thankful that I have these perfectly custom prosthetic breasts, that I can feel totally normal in my skin and be out there in the community and have nobody look at me and stare at me. And then I have days that I don't feel like it. And I want to be more comfortable in my own skin. And so it's okay to not wear them too. And it's okay to do whatever you need to do. That's kind of the beauty of it. There's different supplies and all kinds of other different things that Pretty in Pink can provide you with. Bathing suits, bras, camis, you name it. And just do what works for you. And that's the greatest advice that I can give.